Hi there, my name is Dr. Sarah Wooten, and thank you so much for watching this important video. It's titled The 10 Warning Signs That Your Dog Needs Help Now. So these are signs that your dog is experiencing a true veterinary emergency and needs to go see a veterinarian right now. Do not pass go. Do not collect $200. Do not wait to see if it gets better. Do not wait for your veterinarian to open up the next day. If it's at night, you go to the emergency clinic. Okay, so if you see these things, you go. All right, so you never know. By watching this video, you may be saving the life of a dog that you know and love. Okay, so kudos to you for watching. Let's get into the signs. Okay, so the number one sign that your dog needs veterinary attention now is vomiting repeatedly without bringing anything up. All right, this is called unproductive retching, and it's a sign that something is not kosher with your dog. So the causes of unproductive retching, vomiting without bringing anything up, include bloat, which is when the stomach twists, cuts off its own blood supply, and dies. It is a terrible, painful way for animals to die. It's most common in large, deep-chested dogs, okay? Also, causes for vomiting without bringing anything up could be just profound nausea. So we know that vomiting is controlled in the brain, right? There's an actual vomiting center in the brain. And so nausea is experienced here, right? And so if a dog is feeling nauseous for any particular reason and that nausea is not resolving, you need to go to a veterinarian, because things like vestibular syndrome, where the dog develops a head tilt and falls to the side, that's a brain problem. It can also cause nausea, right? Other causes for unproductive retching include gastrointestinal obstruction. So the dog ate something, it became stuck, now everything is getting swollen, needs to go see a vet. What I'm not talking about is like 1 or 2 retches, and then the dog's totally normal and happy and, you know, doing their own thing. That's not what I'm talking about. I'm talking about a dog that looks sick, doesn't want to eat, it just looks like they're in pain, and the vomiting is continuing and nothing's coming up. Go to the vet now. Go to the vet 10 minutes ago, okay? That's the number one. The number 2 sign that you need to get your dog to a veterinarian is bloody diarrhea. So I am not talking about the dog poops and maybe you see one little streak of blood, right? From who knows where, right? I am talking about blood coming out of the rectum and it's everywhere. This is called HGE, hemorrhagic gastroenteritis, and it is a life-threatening condition. So if you're noticing bloody diarrhea, you need to go see a vet. Also, rat poisoning can also cause bloody diarrhea, and severe bacterial infections with E. coli or salmonella, or Campylobacter, or Cryptosporidium, all those things, they can cause bloody diarrhea. So if you're seeing that, just bite the bullet, get yourself to the vet, get your dog treated. The number 3 sign that you've got to get your dog to a veterinarian is if they are non-responsive. So if you have a dog that has fainted, if you have a dog that has had seizures and then is just laying there, if you have a dog that falls over and is not responding to their name, not breathing, collapsed, it's pretty obvious, but you got to go to the veterinarian. And all is not lost with these guys. Some people think that if something like this has happened, that their dog is just, you know, beyond help, and then they don't go, and then the dog does die. But oftentimes there are things that we can do. And there have been many lives that we have saved, even in dogs that have collapsed. So the number 3 sign, not breathing, not responsive, collapsed, go to a vet. The number 4 sign is a bloated abdomen. So if you are looking at your dog and their abdomen is big and round and maybe even firm, that's a sign of bloat. Remember, we talked about bloat in the number 1 sign. Bloat is when the stomach twists on itself, gets blocked off, and starts to lose its own blood supply and then dies. It is a fatal, painful way to die. Other things can cause abdominal bloating, including heart failure. Right-sided heart failure can cause all of the blood to not be able to circulate, and then it gets backed up in the abdomen. Pericardial tamponade. So the heart has a sac, and if that sac gets filled with fluid, the heart can't expand and pump. Obviously, that could also cause fluid backup. So if you see a bloated abdomen in your dog, you go to the veterinarian, and you go now. The number 5 sign that a dog is having a veterinary emergency and needing care is seizures. So seizures, and I'm talking about kind of the big grand mal seizures. So when the dog usually loses consciousness, sometimes not, sometimes they retain consciousness. And they have what's called the tonic-clonic, where their muscles are doing this kind of thing. Sometimes they lose urine or bowel. Sometimes they lose consciousness. Those are signs that a dog is experiencing a significant adverse neurological event that could be due to any number of factors, including poisoning, right? And you need to take that dog to a veterinarian so that they can get that dog treated and get those seizures started. Because once a brain starts the electrical activity of seizuring, it sensitizes that brain tissue to continue to seizure. So you want to stop seizures as soon as possible. So if your dog is seizuring, and go to a vet. Now, my caveat with that is if you already have a diagnosed epileptic dog. So epilepsy is when they have a seizure disorder. And oftentimes these dogs are already on medication. Sometimes especially if you have a good relationship with your veterinarian, and you've had experience with these seizures, you may be able to wait on going. But if the seizure is not stopping, you gotta go. So if the seizuring is not stopping in an epileptic pet, go. Otherwise, oftentimes if the seizure has come to an end and the animal seems to be doing better, you can often wait and do a phone call with your vet, and they may want you to bring the dog in anyways, or they may adjust your dosage of your medication, right? But that is only for epileptic patients. All the rest of you, go to the vet, go. The number 6 sign that your dog is having a problem and needs to go see the veterinarian is if they refuse to eat for more than 2 days. So dogs will miss a meal on occasion for who knows what reason, right? There's a million of them. But if your dog is normally a good eater and they miss 2 days worth of meals, and so, you put it down in the morning, they don't eat it. You put it down in the evening, they don't eat it. You put it down in the next morning, they don't eat it. You go to the vet. Don't wait. But if they just miss 1 day, you can go if you want. Oftentimes it resolves on its own. But if it's 2 days, you go to the vet. So that's a warning sign, and you know what to do. The number 7 sign that a dog needs veterinary attention right now is if they are coughing up blood, or if they are coughing up pink foam, which is just foam that comes from the respiratory tract or the gastrointestinal tract and is blood tinged. If it's pink, it's got blood in it. If it's blood, it's blood, right? And those are both very not good signs. And vomiting up blood could be a problem with the gastrointestinal tract, the esophagus, the stomach, the intestines. Pink foam could be the GI tract, but it's often the respiratory tract. And dogs that are going into heart failure can cough up pink foam. There's other causes for that as well, but if you see it, it's a veterinary emergency, go to the vet. The number 8 sign that your dog needs veterinary attention now is blue gums. Okay, so check out my gums. Here you go, YouTube. Pink, right? That's what color your dog's gums should be all the time. Pink, maybe pale pink, maybe a little bit darker pink if they've been exercising heavily. So the signs that if your dog has blue gums, that means that oxygen is not circulating throughout the body, okay? And that means fresh blood is not circulating through the body. And that is a veterinary emergency because that indicates a severe issue with the cardiovascular or the respiratory system. And those are your dog's life support systems, okay? So if your dog is panting and you look down and the gums are blue, you go to the veterinarian now. Now, in some cases, there are some poisonings that can cause the blood to actually change colors as well. And it's not a cardiovascular issue. It's more of a blood poisoning issue. but it's still a veterinary emergency and you still need to go. The number 9 sign that your dog is in significant distress and needs the immediate services of a veterinarian is difficulty breathing. So difficulty breathing, what does that look like in dogs? Well, it can look like panting while they're at rest. It can look like when they're laying down and sleeping that they're breathing really, really fast. It can look like dogs that are in respiratory distress often will not lay on their side because it makes them feel like they can't breathe. So they will stay up on their elbows and they'll kind of put their elbows a little bit further out to allow them to expand their chests more. Dogs that are having difficulty breathing, also you'll see a lot of movement in their abdomen, a lot, as they're trying to move air with their diaphragm, right? So that's another sign. And these dogs will often, they may not be responsive to you calling them. They may be very anxious. They may have drool. They may have gums that are not pink. They might be white or blue or pale. But if your dog is experiencing difficulty breathing, you got to go to the vet. It could be anything from heart failure, could be a pneumonia, could be a collapsed lung, could be heartworm disease, could be that they chewed something and it's choking them. Lots of different things that it could be. Bottom line is that if you see that dog is in significant distress and needs to see a veterinarian now. All right, so the last warning sign that you need to go to the veterinarian now is bleeding that you can't stop. So I'm talking about bleeding from a wound. So if the animal has a wound and maybe a blood vessel was hit and that wound will not stop bleeding even with pressure, or if the dog has been hit by a car and you know that's going to be happening, there may be internal bleeding, right? So if the bleeding's not stopping, if it's coming from anywhere, you need to get to a veterinarian so that they can stop that bleeding, assess your pet for any other injuries, and give you the care that you need. So there you have it. Those are the top 10 things that if you see them ever, constitute the necessity of an emergency veterinary visit, either to your local veterinarian or an emergency clinic if it's overnight. Yes, I know it's expensive. Yes, I know it's a hassle. I know it's scary, but by doing so, you may save your dog's life. So I wish you all of the best luck that you never have to see any of these things. That would be the best thing, right? Thank you so much for watching. My name is Dr. Sarah Wooten. My specialty is to come in and talk about healthcare topics and some behavioral topics. If you have a topic you'd like me to cover, leave it in the comment section below. If you like what you're learning, go ahead and subscribe to the channel. You'll get lots of dog fairies will get their wings if you do that. Okay? Thank you. I will see you guys again soon.